what in terms of the sort of treatment options, down the road, what does it look like? Where do we stand right now in terms of potential therapies for this increasing population?
Yeah. First, I would like to just say that, a PD diagnosis is certainly a life-changing diagnosis, but um, it's not a death diagnosis. I mean, meaning people can live a full and rich life with Parkinson's disease. Certainly, things will change. I have to be clear-eyed about that, but it's not one that will mean that that life comes to an end immediately. Um, I think when it comes to thinking about therapies out there for Parkinson's disease, there's a lot of progress being made in symptomatic treatments, which can make living with Parkinson's disease easier. They don't stop the disease, but there's uh, a lot of medications that a person will take with their disease as it advances, and so being able to simplify that process is going to be great. I think there's real hope for a person with Parkinson's around genetic therapies. We've talked about this probably at the beginning around PD generation, and certainly you've seen it now. There are a number of companies out there looking to have targeted therapies for people with genetic forms of Parkinson's disease. And in fact, looking to help people who don't have genetic forms of Parkinson's disease, thinking that these therapies may help people overall. And that's really the hope, I think, with Parkinson's disease, is that we'll see this initial effort with new medicines that target genetic forms of Parkinson's disease that will then help the community more broadly. We're just at the cusp of that. And so we need to wait to see how these clinical trials go. But I think there's tremendous hope because ultimately, if someone has a genetic form of Parkinson's disease, you can clearly point, this is what went wrong in this person's body and is contributing to their disease. So it makes it a much easier job to solve than it would be for someone who has what we call idiopathic Parkinson's disease, where we really don't know why they developed the disease, and so therefore you have to search all over. But with a genetic form, you can really narrow your search to specific proteins in the body that may be going awry, and create a therapy around that. And in fact, what you see is that, as we said, with some people who don't have genetic forms of Parkinson's, those proteins aren't working well for them either. And it's not because they've got a genetic mutation, but there could be part of the disease. And so these therapies really have a great chance. It's much like when we think about statins. Statins really designed to help people who have genetic forms of high cholesterol, lower that cholesterol. But statins are broadly used for anybody with high cholesterol. So I think we may see a similar approach here for therapies for Parkinson's disease. Our hope for certain is that these will work well enough that we can halt Parkinson's disease in its in where it is, and that people can go on and live full lives with Parkinson's as a chronic disease, as opposed to one that's a progressive disease.